All right. So welcome to part 2 of 2015 booklet, Krok 2 2015 booklet. All right. So let's begin. So a 46-year-old patient once took part in elimination of breakdown of an atomic power plant. Currently, he is being treated at an inpatient hospital unit. He was diagnosed with a progressing somatoform dysfunction. Again, you know what a somatoform autonomic dysfunction is, isn't it? These are simply having some sort of, signs and symptoms of cardiac problems and things like that without no obvious genesis or cause, if I'm correct. Basically, that's what it is all about. That's what somatoform autonomic dysfunction is all about. And we have talked extensively on this, disease. Okay. Now, this disease, however, they said this disease relates to the following group of ionizing radiation effect. Don't forget, this person was exposed to an atomic power plant. Okay. And as a result of that, although they're not telling us any obvious pathology inside the person, however, there is an effect of the ionizing radiation that is leading to the somatoform autonomic dysfunction. And they're asking us, what is the effect of this ionizing radiation for which it is causing the somatoform autonomic dysfunction? And over here, what we are going to be looking at for is somatic stochastic effect. Somatic stochastic effect. What are these? These are simply late effects which occur at random with no recognizable threshold. Again, they are late effect of some substances, okay, that has no threshold. Now, we talk about threshold. For every disease to occur, you must reach certain level before it starts manifesting as a disease. In other words, the immune system will start fighting against it until the immune system is compromised. So, in this sort of cases, we are having this effect whereby even without reaching the threshold, there are some effect, or there are some signs and symptoms of that intoxication. And that we call it the somatic stochastic effect. And that is why over here, we are going in for for somatostochastic effect. Now, for all you know, you must understand that all stochastic effects are late. But not all late effects are stochastic. I repeat, all stochastic effects are late effects, but not all late effects are stochastic. Okay. And the probability of their occurrence increases with an increase in the absorbed dose, but not their severity. In other words, the more you are absorbing the dose, even though it has not gotten to a particular threshold, you can still be having this sort of effect because you have been imbibing it in, you have been absorbing it in, and and things like that. So basically, that's why over here we are going in with the stochastic effect, because definitely that is what is happening in a client. So over here, your answer is what? Is A. I think we have discussed this thing too some time ago, but I took my time because it's kind of confusing. Okay. All right. So we have a patient complaining of fatigue, lack of appetite, pain, and burning sensation in the trunk. There's numbness of distal limbs. Diarrhea is present. Pale skin with lemon yellow tint, face puffiness, brown pigmentation in the form of butterfly, bright red areas on the tongue. Liver is 3 centimeters below the costal margin, soft. Look at the RBCs, 1.5. Color index, 1.2. I've told you countless number of times that anytime you are having some sort of anemia, start looking at the blood. Okay, start looking at the blood. And you look at the blood, one of the most important thing is the color index. One of the most important thing is the color index, because the color index tells us what types of anemia we could have. Now, when we have a low RBC, it simply means there's anemia. But what type of anemia are we talking about? Sometimes the RBC could even be normal, isn't it? But the hemoglobin level could be very low, isn't it? And when hemoglobin is low or high, it tells us what condition we could be looking at. Now, with a color index of 1.2, this is high. The normal color index at least should be about 0.9 or 0.8. But to have a color index of 1.2, it means that some substances that are needed for absorption are absent. And those substances are called what? Vitamin B12. Vitamin B12. And usually when there are lots of intrinsic factors, or when there are inadequate intrinsic factors, vitamin B12s are not readily available to be absorbed, isn't it? So over here, we are looking at a case of vitamin B12 deficiency. People can call it pernicious anemia or megaloblastic anemia, and kind of stuff. You are not far from right. Okay. And now look at even the RBCs. They are large in size, microcytosis. And we know that vitamin B12 helps in differentiation of cells. So if the cells are not differentiated, they become very big. When you become very big, color index becomes big. Increases. And that's over here. You can be looking at vitamin B12 deficiency anemia. Vitamin B12 deficiency anemia. Of course, the disease is called what? The pernicious anemia. But to be specific, is vitamin B12. All right. A 25-year-old female patient complains of marked weakness, sleepiness, blackouts, dizziness, taste disorder. 25 years. Patient has history of menorrhagia. That is difficulty or pain, menstrual pains or all those sort of stuff. The lady can relate it more. Objectively, the pain has marked weakness, pale cracks in the corners of her mouth, peeling maze, systolic apical murmur. Blood is this. Look at the hemoglobin level, 70. Now, in Ukraine, the normal hemoglobin level should be about what? 120, especially for ladies, 120. So to have a hemoglobin of 70, it means what? Anemia is present. But look at the color index, 0.75. This is all kind of close to norm, isn't it? It's not that high. It's not that low. Sorry. It's close to norm. Platelets are okay. RBCs are okay. Sorry, WBCs are okay. And even RBCs were okay. So what is the most likely diagnosis? Now, they've told you that this person is having what? A history of menorrhagia. Menorrhagia. And this menorrhagia is simply the medical term for menstrual bleeding that is lasting for more than 7 days. Okay. Having menstrual bleeding. And sometimes these people go through some pains and things like that. Sometimes I pity them. You understand? So I pity them, but I feel for them because they go through a lot. Ladies go through a lot. So guys, Nene and Co, treat your ladies right, okay? Because they go through a lot. So now, having a history of such things where there's what? A menstrual bleeding that is lasting for more than 7 days, this person can develop what we call post-hemorrhagic anemia. Post-hemorrhagic anemia. And of course, for it to last that long, this could be what? A chronic disorder. Chronic disorder. Because obviously, nothing is showing that it is, Nothing is really showing that it is an acute condition. No. but this person has been having a history. That means it's not like it just happened, or the person is now having menorrhagia. If the person is now having menorrhagia, maybe we could say the person having what? An acute condition. But this is not now. This is what? A chronic, because it's a history. It's been there. She's been experiencing it. That is why we're going in for what? For chronic instead of what? Acute. Chronic instead of what? Acute. All right. So your answer here will be B. A 39-year-old patient complaining of morning headache, appetite loss, nausea, vomiting, periodic nasal hemorrhages. Patient had acute glomerulonephritis. Acute. Now, when we talk about glomerulonephritis, we already know what it is. It's where there's a problem with the glomerular system or the glomeruli, where your nephron is, where urine and stuff takes place, So this person is having what? Acute glomerulonephritis. Okay. And you know that the glomerulus helps in filtering. Filtering, isn't it? Good. Now, examination revealed an arterial pressure of 220/130. This is very high. That means that the fluid are not going out. Fluid are not going out. Skin hemorrhages on his arms and legs, pallor of the skin, and mucous membranes. What biochemical parameter is the most important for making diagnosis in this case? Now, if you want to know, or the golden tool or the golden test for, now you want to measure or you want to see if the kidney is really functioning properly, because the person having what? A problem with the kidney. So if you want to diagnose somebody with a problem with the kidney, the most informative or the golden investigation to do is to do what? BUE creatinine. BUE creatinine. BUE creatinine. And talk about BUE creatinine, we are basically referring to what? To creatinine. To creatinine. 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 And that's what over here you are going in with a golden tool, which will be what? Blood creatinine. Blood creatinine. So your answer here is E. Blood creatinine. All right. So a child was taken to a hospital with a focal changes in the skin folds. The child was anxious during examination. Examination revealed a dry skin with a solitary papillous element and ill-defined lichenification zones. Skin eruption was accompanied by strong itch. The child usually feels better in the summer. This is a clue of an allergic what? Reaction. That means it occurs seasonally because the person feels better in the summer, but get worse in the winter. Now, the child has been on a bottle feeding since he was 2 months old. He has a history of exudative diathesis. His grandmother on his mother's side has, again, it tells you that we're having what? Allergic what? Reaction. And to talk about allergic reaction, definitely we are looking at what? Atopic dermatitis. Atopic dermatitis. Atopic dermatitis. So here we are going with E. Atopic dermatitis. Atopic dermatitis. Now, with contact dermatitis, you are thinking of basically more of applying a cream to your skin, and then all these reaction will start taking place. That is more of what contact with dermatitis, and the same applies to urticaria or urticaria. Same applies to what? Urticaria. So when something happens to you, just all of a sudden you start feeling itchiness and all kind of stuff, it can be also what? Urticaria. And actually, their mode of treatment is basically, the same, apart from the fact that you have to remove the allergic reaction that is causing these allergens from happening. That's all. But basically, everything is more the same. So they are all in the differential diagnosis. But over here, with a history of asthma and something like that, we're just thinking of atopic. Atopic means type 1. Atopic means allergic. All right. So E will be our answer. An electrogas welding operator. Electrogas, gas, welding operator. Have you asked yourself why they cover their faces with something when they're, welding, or they're fixing your bicycle or your metals and stuff like that? It's because of their eye. They are afraid of their eye. So they have to cover their eye because flashes or some radiations, can enter the eye and can cause damage to the eye. So even without going through all this question, you must know that we're talking about photoelectric ophthalmia. Photoelectric ophthalmia. We've done this already. So that's the reason why they cover their faces. Okay. So your answer is what? Is A. Is A. All right. Ophthalmia is the eye. So please don't get confused. 2 weeks after recovering from tonsillitis. Guys, even before I go to the questions, what are some of the things you can experience after treating tonsillitis or improperly treating tonsillitis? This one I'll ask questions. Okay. So, Parry, Dr. Parry, that's me for you. Me at any time I can call you. Please give me one complication for somebody or of someone having been treated with tonsillitis or improper treatment of tonsillitis. Give me one of the side effects. Come again?
Glomerulonephritis.
Thank you. That's great. Loretta, give me another one. Dr. Loretta. Loretta, give me another one. Please. Where are they? Hey, Loretta is not here. Okay. Loretta, you are here. Another one. Can you remember anyone? If you've been treated with tonsillitis or strep, come again.
If with this question, the patient has tonsillitis, so it will be glomerulonephritis.
Good.
One complication could also be maybe peritonsillar abscesses.
Okay. What about a heart problem? Can you think of any heart problem?
Heart problem?
Yes. Who can help me out? Any heart problem that can arise?
Carditis.
Myocarditis or
Thank you. Or mitral stenosis, right?
Yeah, infective endocarditis.
Thank you. Awesome. It means that you guys have been learning. That's great. All right, so let's go through the question. So already you know what is in your head. The reason I ask is, when you begin to read a question, you should know already what you're expecting. Okay? They've given you a history of a disease. So starting off with a complication. As simple as that. So you look at the symptoms that are presenting, then easily you can tell your answer without any worries. So now look at it. 2 weeks after recovering from tonsillitis, an 8-year-old boy developed edema of the face and lower limbs. Okay, so Bridget, give me one organ that you can think of when you are having edema formation. One organ.
Either the kidney or the heart.
I said one. So kidney. Okay. Great. Damte, give me another one. Let's go.
Heart.
Let's go.
The heart.
Thank you. Who do I go in for now? Juma, give me another one. Juma, quick. Another one. I've been mentioning this. I mentioned 4 things. Juma, can you hear me? Okay. Eugenia, give me one.
Dr. BAHA, you can also have the liver.
Thank you. The liver. There's one more. Who can remember the other one? Anyone can remember the other one?
the GI.
The GI. Thank you. See, you guys are already good, Charlie. Now, objectively, the patient is in grave condition. So now you're going to think of what? Tonsillitis, the complications, and now the edema. So again, it narrows your answer to what you should be looking out for. Now, BP is normal. Urine is of dark brown color. Oliguria is present. Now they are giving you some signs and symptoms of what? The kidney. You got oliguria. That means inadequate amount of diuresis, urine. Specific gravity of this, red blood cells are leaked and cover the whole vision field. Casts are present, salts. Guy, definitely you are thinking of what? Acute glomerulonephritis. But is it nephritic or nephrotic? Is it nephritic or nephrotic? And what is the differences between nephritic and nephrotic? Please, we are learning, okay? We are all learning, all right? So, who can help me? Who can? Anyone? So, is this question of a nephritic type or a nephrotic type? Because they are telling us that we are having what? RBCs present.
Nephritic.
Nephritic. Thank you. Thank you, guys. Nephritic. And what are the triad? The triad for a nephritic syndrome is what? Hematuria, is how do you call it? Hypertension, or oliguria, or anuria. Then definitely you can start thinking of what again? I don't know, but guys, they are there. They are there. And nephrotic, definitely you see what the proteinuria, the edema, and the other kind of stuff. They are all present. So over here, you are looking at what? Acute glomerulonephritis with a nephritic syndrome. Guys, I love you guys. I love you guys. I love you guys. This is how to answer a question. Okay. Don't get perplexed with the whole plenty things. Don't. Analyze it and you'll be right there. So we have a 48-year-old patient who has the following symptoms: diffuse enlargement of the thyroid gland. Again, I believe you already know what you're talking about. Diffuse enlargement of the thyroid gland. You know it. Guys, there is exophthalmos. Exophthalmos. Weight loss is present. Nene, what diagnosis are you thinking about in this question? Please, fast.
Hyperthyroidism, please.
Hyperthyroidism. Thank you. Hyperthyroidism. Thank you. So if you want to treat hyperthyroidism, you want to what? You want to reduce it. And by reducing it, you're going to use what? A mecazolil. Mecazolil or timazole. Guys, I love you guys. I love you guys. I love you guys. So yeah, answer to this A. Please don't think plenty. Now, if you're going to give tyrosine, you're going to increase the condition or you're going to worsen the problem. You will worsen the problem. So you give the antagonist, or let me just say the opposite drug. So tyrosine is definitely out of question. Now, if you give propranolol is for, arrhythmias and things like that. But over here, they've told you this person is having what? Enlargement of the thyroid gland. So what are you going to do? Guys, you know what I'm talking about. This is how to analyze question. All right? So let's go. A patient is on a sick leave for 4 good months, continuously from the date of the injury. The treatment is ongoing, is going to last for another 1 to 2 months. Another 1 to 2 months. Guys, I don't even wonder myself. Who is responsible for giving such kind of leave? Blessing prayer. Let's go. Who is responsible for giving such kind of leave?
MSEC.
MSEC. Charlie, I love you guys. It's MSEC. 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 So here your answer is what? MSEC. That's what? Medical Advisory Commission after Medical Social Expert Commission. Guys, don't confuse yourself. This is this. The question now is that who is authorized to extend the duration of the medical certificate for this patient? MSEC. Okay, but of course, you might get confused with the fact that there's MSEC here, Medical Social Expert Commission, and there's Medical Advisory Commission after. Of course, you see, this is more detailed, okay? But of course, we know it's MSEC, okay? But I don't know why they have to bring the two, because the two of them can be correct. But of course, since somebody has raised a hand, I will come to you after the presentation, okay? All right, so now we're talking about MSEC. Now, guys, those who just join us, you must know that we've discussed some of these things over and over again. So now we understood it, and that's why I'm just moving like that, okay? So don't mind me. I'm just enjoying myself over here. That's all. So if you are enjoying this, remember to subscribe to this channel so that you don't miss any video that we post over here. Okay. A 30-year-old woman complains of pain in the heart area that arises primarily in the morning hours in autumn and then in the spring. Pain radiates into the neck, the back, the abdomen, and is attended by the rapid heart rate and a low vital tonus. Just before I continue, if you have a question, just jot the question down, okay? When I'm done, you can ask it. Now look at this. This condition occurs independently from physical exertion. It occurs independently from physical exertion. In the evening, her condition improves. Somatic and neurologic state and ECG have no pathologies. They have no pathologies. What pathology is likely to result in such clinical presentation? Ladies and gentlemen, I think we have talked about this like a few, minutes ago. Now, so over here, though there's no, now there are signs and symptoms of heart problems regardless of any underlying cause. Now, you remember that when we talk about the somatoform autonomic dysfunction, although there's no neurologic or, no ECG pathologies, however, something was affecting it. That was the ionizing radiation that was causing the somatoform autonomic dysfunction. Okay, so that's more like there's what kind of exertion, okay, or there's what physical activity happening, or there's something happening. However, there's no obvious neurologic or any ECG pathologies. So going for somatoform. But in case of there is nothing at all, no predisposing factor, no underlying factor causing this kind of thing, we call it the somatic or the somatization or the, you remember when we talk about the neuroasthenic and things like that. I believe you remember it. Great. So please, if you don't remember it, do well to go through all those videos, because these things, they are kind of similar. Please don't go and say this angina pectoris. No, it's not angina pectoris. Don't. In fact, it's even out of question. Okay. So over here, you're thinking of what? Somatized depression, also known as somatic or somatization. Somatization, or you are thinking of what? Of somatoform autonomic dysfunction. But with somatoform autonomic dysfunction, like I said, although there's no underlying cause, but there's something that is leading to it. Okay. Something that is leading to it, but there's no obvious damage. So over here, we're definitely going in for the somatized depression. Somatized depression, or somatic or somatization. And that's over here we are going in it with the C. Somatized. All right. So your answer is what is C. Okay. Now, a 59-year-old female patient attended a maternity welfare clinic with complaints of bloody discharge from the genital tract. Now, post-menopause is 12 years old. So then we are having what? A post-menopausal hemorrhage. And we've talked about it extensively when we're doing the Obs and Gynae base. And we said one way to analyze or to look at the cause of post-menopausal hemorrhage is to do what? Is to do curettage. To check inside what is happening. You remember it, isn't it? Yes. So please, you can do that, or you can even do a laparoscopy. A laparoscopy. A laparoscopy. Now, but you do that when there is no problem with the uterus or the cervix or things like that. Okay. That's when you go in for lapar. But if the problem is inside the uterus, definitely you're going for diagnostic curettage. But let's look at the question. Now, vaginal examination revealed that the external genitalia organs had signs of age involution. So again, because she's aging, things like this are happening. The uterus cervix was not erosive. Small amount of bloody discharge came from the cervical canal. The uterus is of normal size. Appendages are unpalpable. Funuses were deep and painless. What method? So again, we are talking about post-menopausal hemorrhage. And for that reason, we are going for D and C, or diagnostic curettage. No, this is not colposcopy, please. This is A. Please, correction. This is A. This is A. This is A. Not colposcopy. This is A. All right. A 41-year-old patient, a hunter, complains of heaviness in the right subcostal area. The right subcostal area. Again, when you think of the right subcostal area, what comes to your mind? The liver, the gallbladder, isn't it? As simple as that. Now, no other complaints recorded. Analysis says, but don't forget that he's a hunter. Now, analysis states causeless urticaria and skin itching occurred 1 year ago. Okay. The liver margin is rounded, painless, and can be palpable 3 centimeters below the costal arc. That means something is wrong with the liver, one way or the other. Anyway, but let's continue. They said no other pathology was detected during physical examination of the patient. Body temperature is normal. X-ray, guys, look at this. X-ray reveals a hemispherical protrusion in the right cupula of the diaphragm. What disease can be suspected in this case? What disease can be suspected? Now we are seeing something what? A hemispherical what? Protrusion. That means there's something like a cyst present inside the liver. Something like a what? A cyst. Because it is more of what? Rounded in nature. More of what? Of a cyst. And that's what over here we will see we're having what? A hydatic cyst. Hydatic cyst. And again, looking at the history of the patient, we can be thinking of what? Echinococcal infection. Echinococcal infection. Echinococcal infection. Echinococcal infection. So if you're thinking of echinococcal infection, this is just a tapeworm, okay? It's a form of tapeworm. I mean, it's a type of a tapeworm. So if you're thinking of echinococcal infection, then we are thinking of what? Hydatic disease of the liver, or hydatic cyst of the liver, secondary to echinococcal infection or a tapeworm infestation. Basically, that is what we are looking at. That's what we are looking at. Okay, so that's what over here we are definitely going in for B as our answer. This is not a cancer. This is not an abscess. It's neither a tumor, whatever. It is not. But we can think of this as a echinococcal liver. So the answer is B. Is B. All right. A 14-year-old girl has been presenting with irritability and tearfulness for about a year. A year ago, she was also found to have a diffuse, guys, again, we're having a diffuse enlargement of the thyroid gland. This is grade 2. Now, this condition was regarded as a pubertal manifestation. The girl did not undergo any treatment. The girl's irritability gradually gave place to a complete apathy. That means now the disease had taken place. The girl got puffy face, soft tissues, spasticity, bradycardia, constipation, skin pallor, and gland density progress. The skin got a waxing hue. What disease are we looking at? What disease are we looking at? Definitely, we are having, signs and symptoms of what? You can say increased level of what? Of thyroxine. There's an increased level of what? Of thyroxine. Why? Because we're having what? An enlarged gland. But again, you can't say increase of thyroxine also because, or you can't say there's hyperthyroidism too. Because in hyperthyroidism, we are going to see more of what? Tachycardia, more of diarrhea. Okay, that's why there's what? Weight loss in hyperthyroidism. In hyperthyroidism. And don't forget, the fact that there's an increased level of thyroxine doesn't necessarily mean that we're having what? Hyperthyroidism. I hope I'm not confusing you guys. The fact that you're having an increased level of thyroxine doesn't necessarily mean that we're having what? Of course, doesn't mean that we're having signs and symptoms of hyperthyroidism. Great, good. So having understood that, we must understand that this person already is having what? An diffuse enlargement, and they didn't treat it, and now it has become what? A problem, or it has become more of a chronic condition. So again, we can't say we are having a toxic goiter. No. We can neither say we're having what? A carcinoma of the thyroid gland. No. But what we can have, with the history that is being given, we can talk of this as an autoimmune thyroiditis. An autoimmune, which is a chronic disease in which the body interprets the thyroid glands and its hormones as a threat. I repeat, in autoimmune thyroiditis, the body interprets the thyroid gland and its hormones as a threat. Therefore, it produces some antibodies that will target these thyroid cells, thereby destroying it. And that's what I'm saying. In cases like this, it may present with hypothyroidism or hyperthyroidism, and with or without a goiter. With or without. This is the first question I'm talking about in this question. In this case, because I don't think I've explained this to you guys. So this is a new question that I'm taking my time to explain to you. Next time when we see it, we'll just go over it. So please take note of the breakdown that I'm trying to elicit for us. And like I said, in hyperthyroidism, or in signs and symptoms of hyperthyroidism, you can see sweating, rapid heart rate, anxiety, tremors, fatigue, difficulty sleeping, weight loss, protruding eyes, and so on and so forth. Now, the opposite is true for hypothyroidism. The opposite is true for hypothyroidism, meaning there will be weight gain. There will be weight gain, there will be dry skin, there will be fatigue, there will be hair loss, there will be intolerance to cold, there will be constipation. There will be constipation. And that's why over here, we are saying that the immune system is counteracting against the thyroxines and then the TSH. Okay, and that's what we're looking at this as E to be the answer. That's autoimmune thyroiditis. Autoimmune thyroiditis. So please take note of this question. If you have any question, when I'm done, please bring me back. A 26-year-old woman who delivered a child 7 months ago has been suffering from nausea, morning vomiting, sleepiness for the last 2 weeks. She breastfeeds the child. Menstruation is absent, guys. Menstruation is absent. She has not applied any contraceptive. Guys, so Like we normally talk about, if you have amenorrhea or absence of menstruation, what comes to your mind is what? It's pregnancy. So what do you do if if you are pregnant? You either do the human gonadotropin hormones test, or you do what? An ultrasound to check if there's what? A baby inside. Okay. So please do that. So over here, of course, our best option would be what? Ultrasonic examination. Ultrasonic examination or ultrasound examination. Ultrasound examination. Or you do what? The beta HCG. Beta HCG. These are what we use to determine what pregnancy. And the ladies, they know the beta HCG very well. They know it very well. You can ask them. All right. So, Perry, you can ask her, okay? Over a current year, among workers of an institution, 10% have not been ill. Look at it. I think we've done this already. 10% have not been ill a single time. 30% has been ill once, and 15% twice. 5% 4 times, the rest 5 or more. Now, what is the percentage of workers belonging to the first group? You know, the first group of people, they don't get sick more than 2 times. Yeah, more than 2 times, isn't it? They don't get sick more than 2 times in a year. Okay. So some of you are very healthy. Some of you say, oh, the whole year I've not fallen sick. It's because you're in the group 1 health group. Okay. So some people, oh, twice be some cold and maybe 1 or 2 things. That's all. Pim. So let's look at the people who are belonging to the health group. So you calculate 10% have not been ill at all. So 10 plus 30% have been ill just once. So they can form part of the group. So 30. Then we have 50% twice. So we have what? 15. But should we include 5% because they've fallen sick 4 times? Of course not. And the rest 5 or more? Of course not. So we're having what? 10, 30, 15, making it what? 55%. So your answer here is what? 55%. So your answer here is no. The answer is A, not C. Please, your answer is A. It's A. Sometimes when I'm doing things fast, I make mistakes, so forgive me. But the answer is A, not C. It's A. All right. All right. A 34-year-old patient after vacation in Crimea has developed severe pain in her elbow joint, dyspnea, and weakness. Body temperature is 37.6, skin pallor and erythema on the cheeks, and the bridges of the nose and bridge of nose are observed. This question goes to Eugenia. Eugenia, quick. What's your answer? Quick. Eugenia. Where is she? Eugenia is sleeping. Okay. No wahala. All right. So, Kelvin, what is your answer? Quick.
Yes, sir. The answer for this should be systemic lupus.
Systemic lupus. Thank you. Were you sleeping, Eugenia? You are sleeping. Okay. The joints are not visibly deformed. Guys, don't mind me. I'm like that too. I can call you anytime. So if you're sleeping, I'll catch you. The joints are not visibly deformed. Movement of the elbow joint is restricted, blah, 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 blah. Guys, your answer is just what? Systemic lupus erythematosus. And what is the key symptom over here? The key symptom here is what? The presence of a butterfly rash. They don't tell you that it's a butterfly rash. Sometimes they won't mention it. But the presence of erythema on the cheeks and on the bridge is a sign of, how do you call it? A butterfly type of rash or a mala rash. So if you don't see butterfly, you see mala, you see erythema on the cheeks and in the bridge, please, you are thinking of what? Systemic lupus erythematosus. Systemic lupus erythematosus. So your answer here is what? Is B, systemic lupus erythematosus. All right. Several hours before, a 28-year-old patient suddenly developed acute headache and a repeated vomiting, then loss of consciousness. Objectively, focal neurological symptoms were not found. Focal symptoms were not found. Guys, look, there is a pronounced meningeal symptoms were revealed. Pronounced meningeal symptoms. Okay, so let's go. We're going to give 3 differentials of, what can cause meningeal symptoms. 3 differentials. So, who should I call? Who should I call? Sam, give me one. Sam, now you're no more new to my classes, okay? Now you're an old guy. So, Sam, give me one differential for meningeal symptoms. One differential, just one differential. Or you're also sleeping?
Can I speak?
Please, shoot. Speak, Cynthia. Or who was talking?
Okay, there is stiff neck.
Yes, stiff neck is one of the signs of it. But my question is, what are your differential? Differential is a disease. Stiff neck is a symptom. Okay. Stiff neck, Brozinski, Babinski, whatever you want.
Babinski,
yeah.
Koenig sign.
Koenig sign. All of these are all the symptoms, or they are the meningeal symptoms. But my question is, what can cause those symptoms? Loretta. What's that?
Subarachnoid hemorrhage.
Subarachnoid hemorrhage. So bleeding can cause it. Who else? Who will give me one? Christopher, finally you are here. I've been looking for you, Christopher. Give me one.
I'm just stepping in.
I'm just stepping in. Okay.
Meningitis.
Meningitis. Thank you. Meningitis. Golo, give me one. Give me one.
Subarachnoid hemorrhage.
Subarachnoid hemorrhage. So you guys have all said it. So you can talk about the types of meningitis. You can think about the differentials. See, in exams,
encephalitis.
Encephalitis. Thank you. So in exams, you see, when I ask you, is that Uche? Who just spoke?
Yes, sir.
Welcome. All right. So guys, so this is the thing. In exams, okay, if you mention meningitis, you have restricted yourself totally, because we are different types of meningitis. So if I were in exams, in case of course they ask you to mention like 5 differentials, please, after mention your encephalitis, your maybe hemorrhage, please mention different types of. Don't just go and say, and don't forget, malaria can also cause meningitis. Meningeal symptoms. Malaria can also cause it. Severe sepsis can also cause it. Please don't forget. All right. So that's just by the way. But to confirm it, you have to do what? What test do you do to confirm? This question goes to Yaira. What test will you do to confirm, meningitis or meningeal symptoms? What test will you do? Lumbar puncture. So basically, you want to analyze the CSF. Great. So now let's continue. Now they say blood pressure is 120/80 according to the clinical and the leptospirosis findings. That is the liquor. That is the CSF. The patient was diagnosed with subarachnoid hemorrhage. So those who said subarachnoid hemorrhage, this is your client. Now, after administration of dehydrant, the patient's condition somehow improved. Now, what is the main component of further emergency care? So someone is bleeding. That's the question. So what are you going to give? Someone is bleeding. What are you going to give? This question goes to Lawrence. A patient is bleeding. Okay? A patient is bleeding. What will you give for the person to arrest the bleeding or to perhaps reduce the bleeding? Lawrence. I think I saw him here. Oh, Lawrence is out. No, Lawrence is here. Lawrence. Okay. Yes. Someone is talking. Who is talking? Lawrence. Lawrence, what will you do? What will you give? What will you do? Someone is bleeding. What will you give?
Hello.
Oh, I can hear you now. But you keep going and come again. Okay. I can't hear you properly. So I will throw the questions to Dummy.
Anticoagulant.
Anticoagulant. What is the meaning of anticoagulant?
Like you use it like when there's like blood clot or excess blood flow, I think.
But are we having blood clot here?
No, we're having excess blood flow.
We're having excess blood flow. So what will you do?
Oh, sorry. So coagulant. I'm sorry.
Coagulant, exactly.
I'm so sorry.
Please analyze the question.
I didn't see the coagulant option.
Uh-huh.
I didn't see the coagulant option. That's why.
Good. My mindset is not
Like
even
I saw
on
the
there.
answer.
Good. My mindset is not even on the answer safe. I want you to understand what you are dealing with. Okay. If you understand
I get it. Like,
it's always
that's
good.
why.
Great.
Yeah,
Great.
I understood it. I just.
Good. So obviously you want to give this person what? Coagulant, because you want to prevent the bleeding from happening. If you go and give anticoagulant, anti-aggregant, fibrinolysis, you are going to cause more harm than good. Because all of these will cause more bleeding. All right. So your answer here is what? It's A. Coagulant. All right. So we move. A 12-year-old man has undergone gastric analysis. Free hydrochloric acid is absent at all phases. So HCl is absent. Now, on endoscopy, there is pallor, there's gastric mucosal loss, there's gastric folds are smoothing out, there's glands atrophy with intestinal metaplasia. What disease can be characterized by such representation? Obviously, there is a problem with the stomach. There's a problem with the stomach. And anytime we have a problem with the stomach, generally, we call it what? Gastritis. So now if you don't know the exact type of it, we just say patients have what? Gastritis. So even the ulcer that you'll be talking about in future and things like that, they are all forms of what? Gastritis. Exactly. They are all forms of what? Gastritis. And in gastritis, we have A, we have B, we have C. Type A, type B, type C. Now, in type A gastritis, it is autoimmune. It is autoimmune that affects the body and the fundus of the stomach. And it is very common with pernicious anemia. So when a patient comes to you with the pernicious anemia, now when I talk about pernicious anemia, you know I'm talking about vitamin B12 deficiency. Vitamin B12 anemia. Or vitamin B12 deficiency anemia. Isn't it? Because it affects the what? The how do you call it? The absorption of what? Intrinsic what? Factors. And that is type A. Type A. Now in type B, we're basically thinking of more of the antrium. It is more common with H. pylori infection. So people with H. pylori infection, we are talking about type B. We are talking about type B. Now, type C is caused by irritants like NSAIDs or non-steroidal anti-inflammatory drugs or alcohol or bile and those sort of things. Okay, that is what happens. That is what happens. So over here, we are not really talking about what? Ulcer, because there is no sort of what erosion per se, although there is what? Atrophy. And that's why in atrophy, we are thinking of what? Autoimmune infection. And like I said, autoimmune infection is a type of what? Of course, type A gastritis. So if you have a patient who is having H. pylori infection and so is developing ulcer, it is type B. I love medicine. Medicine is so sweet. It is type B. Okay. Now, if you have a person who, because you have given diclofenac and other NSAIDs or alcohol, people who drink alcohol and people even smoke, and they start having gastritis or stomach pains or, mention them, or erosion or, ulcer, you are thinking of what? Type C. I hope I've, illustrated everything for you. Of course, cancer is a cancer. So that one, it's a cancer. But over here, we are looking at what? Type A, gastritis. Type A, gastritis. So your answer is C. Type A, gastritis. Type A, gastritis. And again, don't forget that hydrochloric acid is absent. And you know, one of the things that can cause gastritis or that can lead to ulcer is it's when there's increased level of what? Hydrochloric acid. But in the case, it is absent. So here, that means the cells that are even producing it are even absent. And that to tell you that there's some infection going on there. Hence, autoimmune type A gastritis. So answer is C. Medicine is so sweet. Charlie, it's sweet, it's sweet, it's sweet. A 24-year-old woman, teacher by profession, complains of dizziness, heart pain that is radiating to the left nipple. Pain is not associated with physical activity. Guys, remember, pain is not associated with physical activity and cannot be relieved by nitroglycerin. It abates after taking valocodine and lasts for an hour or more. The patient has a nearly 2-year history of this disease. Heart rate 76, BP 110, heart borders are normal, heart sounds are clear, ECG shows respiratory arrhythmia, X-ray of the cervicothoracic spine shows no pathology, lungs, abdomen are unremarkable. What changes can be seen? What changes can be seen? So over here, we are having a case of a functional or mental changes. We're having a case of what? Functional or mental what? Changes in this patient. That's leading to what? The presentation. Okay. That means there's no organic changes. No organic changes. And if there's no organic change, because they said X-ray shows nothing is wrong. Shows nothing is wrong. Lungs, abdomen, nothing is showing. So if there's no organic changes, what are you thinking about? Of course, there'll be no changes in the leukocyte. No changes in the blood formula. No changes. No infection. No anemia. Nothing will be shown. Nothing. Okay. So that doesn't have what? A functional changes. Functional changes rather than an organic changes. All right. So here we're looking at what? A. So you can be looking at this as a case of somebody suffering from this neuroasthenic stuff that we talk about, the somatoform and all those kind of somatic depression kind of stuff. We can be linking this to that kind of a situation. Okay. Nothing is showing, but we're having signs and symptoms of the heart. So your answer here is A. All right. Chief physician of a polyclinic tasked a district doctor would determine the pathological prevalence of a disease N in his district. What document allows to estimate the disease prevalence in the population of a medical district? Now, prevalence is a statistical concept that refers to the number of cases that are present in a particular population at a given time. That is what is meant by prevalence. Okay, so you want to know the disease that is occurring at this particular time, both old and new occurrence. Both old and new. Like we are having in this era of COVID, COVID-19 and things like that. Okay, we have the disease over here. So if you want to estimate, now the question now is that what document allows you to estimate the disease prevalence? That means what will help you to know that this disease is actually, is becoming more common among the population. What document will allow you to do that? Now, have you asked yourself why there's now COVID? Vaccine being distributed all over the world, and Ghana being the luckiest is having the first to be received in Africa. And that makes me proud as a Ghanaian anyways. But far from that. Now, the reason why we are giving the vaccine is to reduce the prevalence rate. Is to reduce the prevalence rate, isn't it? Or to reduce the number of people having the disease or new diseases coming to add up to the old diseases that are already there. So you vaccine them or you vaccinate them. You immunize them. So the thing that can help you or the doctor can help you is to do what we call a prophylactic examination. Prophylactic is more of a vaccination, giving something to somebody to prevent the occurrence of the disease. Giving something to somebody to prevent the occurrence of the disease or to control the disease occurrence. And that's what over here we'll go in with what? A prophylactic examination register. So your answer is D. Your answer is D. So you can find more of these on our Medent website, medentweb.com. I will put a link in the description so that at the end you can just check it out to solve more questions and practice more. So let's continue. A 32-year-old woman complains of dizziness, headache, palpitation, and tremor. For the last several months, she has been under outpatient monitoring for an increased arterial pressure. Recently, such attacks have become more frequent and severe. Skin is covered with a clammy sweat, tremor of the extremities is present. Heart rate 110, BP is too high. Heart sounds are weakened. In the blood, WBC is 9.8, ESR is 22. Look at the glucose, 9.8. What disease is the likely diagnosis of this crisis? So guys, you must understand that an extremely high arterial pressure and increase in glucose is typical for tumor of the adrenal gland. I repeat, increased arterial pressure or high blood pressure plus an increase in glucose level is typical or is classic for tumor of the adrenal gland and hence Pheochromocytoma. Pheochromocytoma. And the signs and symptoms there, of course, tells you the fact that there's a lot of catecholamines being present in the system. And that's over here. We are going in with what? With Pheochromocytoma. Pheochromocytoma. So D is your answer. All right. A 45-year-old patient complains of pain in the epigastric area or region. Left subcostal area. Oh, left, guys. Left, not the right. So epigastric, and then we have what? The left. There's abdominal distension, diarrhea, loss of weight, suffering from this condition for 5 good years. Whatever it is, this is a chronic condition. Tongue is moist with white coating near the root. Deep palpation of abdomen reveals slightly pain in the epigastric region. Guys, look at this guy. Myopsin point. Myopsin point. One of you know what myopsin point is like an imaginary line that is drawn from the umbilicus to somewhere around the iliac, the 2/3 of it, somewhere around that area. And that is a sign of pancreatitis. It is a sign of pancreatitis. Please take note. If myopsin is positive, please start drawing your mind towards pancreatitis or the pancreas, to be specific. Draw your minds to the pancreas, So definitely over here, we are looking at the case of what? Pancreatitis, and hence chronic pancreatitis. Don't forget the liver is painless and produce 1 centimeter. Spleen cannot be palpable. So forget about the liver, forget about the gallbladder. You are thinking of what? Pancreatitis. Hence, your answer is D. A 58-year-old woman complains of a spontaneous bruises, weakness, bleeding gum, dizziness, mucous membranes and the skin are pale with numerous hemorrhages of various time of origin. Lymph nodes are not palpable, heart rate is this, BP, no changes of internal organs, blood test revealed RBC is that, hemoglobin is that, color index is that. We have anisocytosis, poikilocytosis, WBC, eosinophils, stap, neutrophils, segmented, lymphocyte, monocytes, blah, 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 blah. Now, what laboratory tests should be determined additionally to make a diagnosis? Now, they've given you the blood analysis, but the question is, what are you thinking about? What are you thinking about? And definitely, I'm going to call somebody to tell me what the person is thinking about in this. I mean, what diagnosis can you even look out for in this patient? What diagnosis are you looking at for? Timothy, what diagnosis are you looking at for? Spontaneous bruises, bleeding all over. What comes to your mind? Can you hear me?
Yes, I'm trying to read the question.
Good. So we're having spontaneous bruises, bleeding, hemorrhages all over at different times. Though they'll give you the blood analysis, but the question is, forget about what to do. I'm asking, what is your diagnosis? What comes to your mind as a doctor? What comes to your mind where there's bleeding disorder?
Hemophilia.
Please. Platelet.
Nice. Exactly. Hemophilia. You get it? Hemophilia. So don't waste your time thinking too much. So if you're thinking of hemophilia, definitely you'll be looking out for what? For the platelets and things like that. Although you should also consider the clotting factors as well. Okay. But the platelets, clotting factors, because hemophilia basically deals with, how do you call it? The clotting factors and things like that. However, over here, what additional lab tests will you look at for? Definitely, you're looking at for what? The platelet. So the answer should be E, platelet. Okay. But of course, you can go on to check the clotting the clotting time, the clotting factors, all of those things. You can go on and on to add all those things. But the most important thing is to check if indeed, either hemophilia or you're even thinking about purpura, right?
Thrombocytopenia.
Yes, thrombocytopenia purpura. Thinking about this thing. So if you're thinking about these two, definitely check out for the platelets, check out for what? The clotting factors and so on and so forth. So over here, your answer is E. I love my doctors. You people are making me happy. After examination, a 46-year-old patient was diagnosed with a left breast cancer, T2N2MO, group 2A. What will be the treatment plan of this patient? Guys, forget about T2NMO, blah, 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 blah. This person is definitely having what? A breast cancer. I don't know if I mentioned it over here, but yeah, for the benefit of learning, let me tell you what the T2, the N, whatever. Now, T2 simply means the tumor is invading the muscularis proper.
Yeah.
T2 means the tumor is invading or has invaded the muscularis proper. The N2 means it invades 15 regional nodes. 15 regional nodes. That means it's kind of, MO means there's no metastasis. Now, when you say metastasis, that means it has not yet spread to other organs, although it has invaded regional lymph nodes, but it has not undergone what? Metastasis. Basically, that is it. But whatever be the case, this is person suffering from what? A breast cancer. What is the mode of treatment for breast cancer? Please take it from me. Write it down. Surgery, chemo, radiation. Surgery, chemo, radiation at all time. Surgery, chemo, radiation. Don't think twice about it. So over here, our best option, obviously, would be what? Radiation therapy plus operation, which means surgery, plus chemotherapy, as simple as ABCD. As simple as ABCD. So here, your answer is what? Is B. Your answer is B. Medicine is just sweet. In Riverside urban community, there was an outbreak of hepatitis type A. Hepatitis type A. Now, what is the mode of infection for hepatitis A? This question goes to, I've not taught you guys, but I mean, let's think of something. Anyone can answer this question. I've not taught you guys, but what is the mode of infection of type A hepatitis? Is it by blood? Come again?
Alimentary.
Water.
Yes, alimentary, water. Yes, fecal oral. Exactly. Fecal oral, as simple as that. So you see, they're even saying that it is possibly spread by water. But type B is by blood, isn't it? Good. Now, what indexes of river water quality can confirm this theory? What it means is that how are you going to confirm that this infection was through the water or was via the water body they are talking about? And so over here, you want to determine the microorganisms of the water bodies or the water that you are drinking or possibly you are using. You want to check the water body that the community is using. You want to check the pathogens, the microorganisms that are present. And we know when we talk about the microorganisms, you are talking about the coliform bacteria, the E. coli, you are talking about the caliphages. These are all used as indicators to check for water quality. Again, coliform bacteria, E. coli, coliphage, they are all used to determine water quality. However, coliphages are viruses. Coliphages are viruses. And yeah, they are what? Viruses. Basically, they are viruses. Okay. Now we talk about E. coli. E. coli is a bacteria, isn't it? E. coli is a bacteria. Now, when we talk about hepatitis type A, hepatitis, this is a viral infection. I love medicine. This is what? A viral infection. And that's what over here, you'll be thinking of the coliform bacteria. No. You should be thinking more of what? Of a caliphage number. Because caliphage will be telling you about viruses that are present, that is causing the hepatitis. And that's what over here, we are going by what? By E. Sorry. Answer is C. C, not E, please. It is C. C. A caliphage number should be your answer. It is C. Guys, you see how medicine is sweet? It's sweet. It's sweet. Hepatitis. This is viral infection of the liver. All right. Now, we have a 25-year-old patient was delivered to an infectious disease unit on the third day of illness with complaints of headache, pain in the lumbar spine, and gastrocnemius. I say gastrocnemius muscles, high fever, and chills. Don't worry, this is a coded thing, so you will understand. Only I say can relate. Objectively, condition is of moderate severity. Scleras are ecteric. Pharynx is hyperemic. Trunk is dry with dry brown coating. Abdomen is distended. Liver is enlarged. Spleen is not enlarged. Hepatitis of the palpation of the muscles, especially gastrocnemius muscle, is painful. Urine is dark. Stool is normal. What is the most likely diagnosis? I know somebody, I think Sharif, posted a whole lot of differentials about people suffering from what? Gastrocnemius, okay, or people having pain in the in the gastrocnemius or in the calf. And this is one of them. So basically, you're looking at this as leptospirosis. Leptospirosis. And one of the things is that it can cause jaundice. Okay, it can affect a lot of tissues in the body, especially the liver. So it can cause jaundice formation. It can destroy red blood cells. Okay, it can destroy red blood cells. That's what I see the urine color to be dark in color. That means it could be that blood is coming out. Jaundice can be present. That's what they're saying. The sclera is ecteric. So please take note of some of these clues that you will need in your exams. And even on the field as well. So here we are looking at what? Leptospirosis. All right. A patient suffering from acute post-traumatic pain receive an injection morphine. Morphine is an opioid. That brought him a significant relief. Which of the following mechanism of action provided for anti-shock effect of morphine in this patient? Guys, don't stress yourself too much. What is the way of mechanism of morphine? Of course, they operate through the opiate receptors, isn't it? They operate through the opiate receptors, basically, opiate receptors. So this one is C, the opiate receptors. Okay, so they will reduce the nerves that is causing pain and things like that. Now, a 9-year-old child present with fever, cough, dyspnea. Okay, the symptoms appeared 5 days ago after a contact of the person having upper respiratory tract infection. Okay, child is in grave condition, temperature 38, cyanosis of the nasolabial triangle. That means breathing is becoming quite difficult. That's what the cyanosis. Don't forget. If you see cyanosis, don't take it lightly. It means problems with the lungs. Now, respiration rate is 54. Again, tells you that this person having severe dyspnea, although they've mentioned over here. They've mentioned cough too. And there's fever, that means infection. Nasal flaring while breathing. There was percussion dullness on the right below the scapula and the tympanic sound over the rest of the lungs. Again, this is a sign of what? Consolidation. So these are signs of what? Consolidation, isn't it? Exactly. Now, auscultation will reveal a bilateral fine moist rose predominating on the right. What is the most likely diagnosis? Guys, the person having what? The man came in contact with the person having what? UTI, upper respiratory tract infection. And the person having difficulty in breathing, the lungs is compromised, everything. So what can you be thinking about? Of course, you are thinking about where the exchange of gases are taking place, which is the lungs. And so therefore, you are looking at this as a pneumonia. Because exchange of gases is being impaired. So you're thinking of this as a pneumonia. So your answer here is what? Is B, acute pneumonia. All right. A 50-year-old patient complains about having pain attacks in the right subcostal area for a year. Again, right subcostal area. What comes to your mind? Your liver or your gallbladder? Medicine is good. The pain arises mainly after taking fatty food. Guys, I'll not even bother myself to worry myself. So this question goes to who am I calling? Naveen, look at it. You are having a person having a right subcostal area pain, and it mainly arises after taking fatty food. What organ are you looking at? What organ? Be specific.
Liver,
Come again.
Liver.
Liver. But this one is not about what? After taking fatty food, there are two organs, liver and another organ. What other organ are you talking about?
Kidneys.
No. Right after the liver, we're having what is below it? The gallbladder.
Gallbladder.
Exactly. The gallbladder. And you know the gallbladder is responsible for producing what? Bile. And this bile will have to emulsify what? Fat. This bile will have to emulsify the fat. So if they are saying that there's a pain that's arising after taking fatty food, it means that the gallbladder is under duress, it's under stress, or is being inflamed one way or the other, is being inflamed. And that is when you're taking fat and it's not supposed to secrete or eject bile so it can digest the fatty food. It starts causing pain because there's infection there. So that comes to your mind. So gallbladder comes to your mind when they talk about what? Pain after taking in fatty food. Now they're saying that over the last week, the attacks occurred daily and became more painful on the third day. You see, there's what? Jaundice, light-colored feces, and dark urine. Again, these are all signs of what? Jaundice. There's even what? Neutrophilic what? Leukocytosis. What is the likely diagnosis? So again, definitely you are thinking of what? Cholecystitis. You are thinking of cholecystitis. But for us to have jaundice and present, you are thinking of what? A mechanical jaundice. Mechanical jaundice. When we say mechanical jaundice, that means this jaundice occurring after the liver or post-hepatic jaundice is same as mechanic or obstructive. And that's why over here, we can classify this as a chronic calculus. That means something is blocking it and it is causing the infection and it's causing the pain. So you can look at this as a chronic calculus cholecystitis. Chronic calculus cholecystitis. As simple as that. That's why I said I love medicine. All right. So we're having a 52-year-old woman complain of face distortion. It appeared 2 days ago after exposure to cold. So what is responsible for, what nerves passes through the face? Anyways, let's continue. Body temperature is 38, face asymmetry is present. That means it's not occurring symmetrically. It's occurring on one side of the face. I love medicine. It's occurring on one side of the face. It's a unilateral. Okay. Frontal folds are flattened. Left eye is widened than the right and cannot close. Its mouth corner is lower. Examination revealed no pathology, no other pathology. Left side is 10, ESR is 20. What are you looking at? Nene, what are you looking at? Just tell me. What are you looking at?
We are looking at the facial nerve.
Facial nerve palsy, my brother, my sisters. Facial nerve, my brother. Facial nerve. Medicine is just sweet. So the answer is what? Is D.